Hi, we're going to talk about the use of cannabis for multiple sclerosis. This is actually something that's been studied by clinical trials. And what's been found in those studies is that people with multiple sclerosis use cannabis for three main reasons. One is quality of life, two is mood, and three is to reduce muscle spasticity. As far as regulating the course of the disease itself, it hasn't been proven that cannabis can be useful for that, although some people do claim that they've been on cannabis for years and their multiple sclerosis hasn't gotten worse, but it's not been proven. So if you're going to use it for sleep, you should check the insomnia section because the same information applies. You'll need to use an indica. For quality of life, that's a little bit more complex, and that's where I look to my patients to tell me what really works the best. And surprisingly, most of my patients with multiple sclerosis prefer to inhale. In the past, it was a lot of smoking. Now it's switched more to vaporizing. And apparently the quick onset of action, which happens with inhalation, which comes on in about 5 to 10 minutes, gives you immediate change in mood and perception, relief of muscle spasm. The quick fix is something that is really appreciated by multiple sclerosis patients. So I do find that they prefer to inhale, 4 to 5 times a day. And that's about right. If you're getting 3 hours a day of relief, if you do it 4 to 5 times a day, that covers your daytime use. If you're going to use an indica for sleep, then you're going to use probably a different strain than you use during the day or a different vaporization mix. And here we find that mixes ranging anywhere from pure THC to a CBD THC 1-to-1 mix is what people prefer. But last but not least, if you're trying to really reduce spasticity and you're on an anti-muscle spasm drug such as baclofen, you're going to have to use an internal edible or oil, something ingested at pretty high doses. So to replace baclofen or a muscle spasm drug, you might have to be using 10 to 25 milligrams of a CBD THC mix up to 3 times a day. So the improvement of quality of life for multiple sclerosis patients is no small ordeal. It is a chronic disease. And you're looking at a medication that you're probably going to be needing to take ongoing. So it's important to consider tolerance. In that regard, I'd try to stick to more of the 10 to 15 milligrams 3 times a day as an ongoing dose where you won't reach tolerance.